Good afternoon and good evening, everyone. I'm Catherine Liu, and I'm the director of our data and analytics team here at BAO Systems. So welcome to this session. With me today are Marianne Parrish and Lucia Fernandez Montoya. Marianne is an M&E specialist at Apt Associates who is supporting the development and use of VectorLink Collect, the project's DHIS2-based data management system for entomology data in 10 different countries. Lucia is an entomology and vector control specialist at WHO's Global Malaria Programme and is responsible for the development of guidelines and DHIS2-based digital tools to support countries to strengthen entomological surveillance, insecticide resistance monitoring, and the monitoring of vector control interventions. So today we're going to hear a little bit from them in terms of what you will be hearing. Nearly half of the world's population lives in areas at risk of malaria transmission, and data from entomological field surveillance are critical to inform key malaria control decisions. The WHO and PMI's VectorLink Project are collaborating to transform complex entomological data into actionable decisions. During this session, our co-presenters will provide an overview of the DHIS2 models that they've developed and are implementing. They'll highlight key analytics for entomological data and share insights from this unique global partnership. Just a reminder for those participants joining the session today, go ahead and place any questions that you have for Lucia and Mariam in the Q&A, and we will reserve about 15 minutes at the end of the presentation to address questions that you guys have. So thanks, and over to you, Lucia and Mariam.
Thank you, Catherine. I'll start the presentation and then Marianne will continue. Please make sure that you check the pool. We've got 3 fantastic questions there for everyone that is listening to this presentation today, and we'll make reference to them during the presentation, so please go and answer them. So I'm Lucia from WHO Global Malaria Programme, and with Marianne Parrish, we're going to be presenting how we have been working on aligning and making our 2 DHIS2-based data collection systems for entomology and vector control data aligned and interoperable. So since 2018, we've been working to align these 2 systems in order to improve the collection of entomological data and vector control data in countries, but also to improve sharing of data across different institutions and sharing of data with ministries of health in countries which are the ones that need the data the most. So from WHO side, for the last 3 years, we have been developing DHIS2 standard packages to help countries collect entomology and vector control data in a standard way based on WHO recommendations. But to import or to do this data collection process inside of the national health information systems, so that entomology and vector control data can be brought together with epidemiological data or data from, for example, stock management systems, to gain a better understanding of malaria transmission patterns in countries, to be able to better evaluate the impact of malaria control interventions conducted in countries. Also to rescue, in a sense, historical data. There is a lot of historical entomology and vector control data historically collected through projects, through sites, which is a little bit all over the place. So we are hoping that by implementing these modules in health information systems, all of this historical data can be rescued, analyzed, and interpreted to build historical knowledge on entomology and the effect of vector control interventions. So also to say that these modules are comprised of standard data collection forms, automatically calculated entomological indicators, are also dashboards to guide the interpretation of this data. And that WHO is not only developing these modules for countries, but WHO also has a DHIS2 instance here installed or implemented in our headquarters in Geneva, where we are collecting data from all of the countries in the world on the status of insecticide resistance, which is a big threat for vector control worldwide. So we are using DHIS2 both for our own purposes of global monitoring and also to provide countries a tool to strengthen their systems. So now Marianne is going to explain to you what VectorLink is doing.
Great, thanks, Lucia. The PMI VectorLink Project is funded by U.S. President's Malaria Initiative. We started in 2017 and will end in 2023. The project serves 24 sub-Saharan African countries in addition to Cambodia and Colombia. The main goal is to reduce the burden of malaria in these countries. One of the essential components to the success of our project is a working relationship with the Ministries of Health, specifically the National Malaria Control Programs. The first step is to create a plan to implement vector control interventions. So that includes insecticide-treated bed nets, or ITNs, the distribution of these bed nets, and then also indoor residual spray campaigns, which I will refer to as IRS campaigns from now on. To supplement these interventions, the project supports robust entomological monitoring that is often done on a monthly basis. A key part of these activities is to build the capacity in the generation and the use, especially the use of data for strategic malaria control decision making. As Lucia alluded to before, one of the key reasons why this collaboration occurred between WHO and PMI VectorLink is historically the entomology and vector control data has been really scattered. They are different workflows. There's different people involved in collecting and analyzing this data. So it's been often underutilized. And this is a problem as the field of entomology and vector control is evolving, and the need to base vector control decisions on entomology is increasing. So the collaboration between WHO and PMI VectorLink really sought to, as our global scope aligned as well as our goals, we sought to work within DHIS2. As you all know, it's an open source platform. It's widely used in countries for health monitoring information systems. So we used our standardized data collection processes that we collaborated with WHO to develop and built the modules on DHIS2 to create the PMI VectorLink project system called VectorLink Collect to align with the WHO modules. This collaboration really maximizes the sustainability of the data use efforts within the project as countries begin to as they opt to adopt the WHO modules, they'll be able to interface with the VectorLink vector control data and be able to use it moving forward.
Marianne, or Lucia, you're on mute still. Sorry.
Okay.
Sorry, I was saying that to seize the opportunities that Marianne was mentioning before, we decided to align our data collection processes as much as possible and to connect it so that we can share data between the two DHIS2 instances, the WHO DHIS2 global instance and the VectorLink, but also the instances in the countries and the VectorLink instance. So basically malaria, the highest burden of malaria is still in Africa. So most of the countries that are adopting the WHO standard packages are African countries. And VectorLink is collecting entomology data in 18 African countries and indoor residual spraying, IRS data, in 17 countries. So there is a great opportunity there to align data collection processes in those 18 and 17 countries. So we started, next slide. We started by comparing our DHIS2 systems because we both started the development of data collection processes in DHIS2 without really knowing of each other's plans, and we got to know a little bit later. So we had to compare and map the work that we had been doing before to try to align it as much as possible. And as you can see, VectorLink Collect was collecting data on many of the activities that the WHO modules were already supporting or aiming to support. And actually, for indoor residual spraying that you see there, WHO hadn't developed any modules yet, and VectorLink was able to contribute the metadata they had been developing through a very long process of thinking well through how to collect this data in the best possible way to the WHO standard packages. And now we've adopted this and we are distributing these packages to countries. So looking forward, we both had the intention to continue developing more data collection forms, better data collection processes, to the point of developing a mosquito tracker and go back to the pool and answer the question on the mosquito tracker, because we are tracking mosquitoes individually one by one. So we both wanted to do this. This is quite a need in the field. And we both wanted to connect our field teams. And again, in the pool, you can see that there is data, people that are collecting mosquitoes one by one on a daily basis. So we wanted to collect the field work that is happening with the people in the labs processing the mosquito samples. And we wanted to build a tracker for that. So we started working together so that we can have the same tracker, the same data collection process, the same approach to this, so that when it comes to then sharing data in countries, it is 100% aligned. So this is one of the things that we are doing now. And for the data collection forms and systems that were not exactly the same, we've been going through a long process of mapping all of it and identifying things that need to happen to be able to share data. And next slide. So of course, just the DHIS2 systems couldn't handle really the mapping of the two instances and the moving of data from one instance to another one. So WHO was working on an application called Metadata Sync to be able to share data with countries. So from the WHO global instance to the DHIS2 instances in the countries and vice versa. And we thought that could be a great opportunity there will be a great opportunity to expand the functionality of this application to also make VectorLink DHIS2 instance and the global WHO instance interoperable, and the DHIS2 modules for countries and the VectorLink DHIS2 instance also interoperable. So in the last few months, we've been working to expand that functionality. We are now in the process of testing it. And this is an application that will be able or will allow any of us to send data from our own DHIS2 systems to the DHIS2 systems of the partner, without having to export the data outside of DHIS2 and import the data back into DHIS2. So it's quite a great solution, and we are seeing how far we get into it, but we are aiming for a full interoperability solution through that application. Then I wanted to highlight as well that this collaboration has led into improving other applications that WHO was working on. One of them is bulk loads. It's an application that we improved. It existed already, and we improved it to bring historical data into these DHIS2 modules, because as we said, there's a lot of historical data, but all over the place. So also through the collaboration with VectorLink, we've been able to improve the testing of the application, identify weaknesses, identify new features that we have to develop, and slowly improve this application so that it can support quite of the complex data collection process that we do in entomology and vector control. And the third application is something that I just wanted to mention to you, because maybe some of you are interested. It's an application that WHO developed to provide interactive training tutorials through DHIS2, through an application inside of DHIS2, to show end users how to accomplish specific data collection processes, starting from which application to open, how to select an organizational unit, how to select the program, how to open a data collection form, how to fill it in, etc. And I thought it could be maybe useful for some of the audience here today. Next slide.
All right, this is me.
That's yours.
Yes. So all of these tools that we've been working on together and improving over the last few years, really the main goal is data use, that we want to make the entomological results and vector control results more accessible. So in the last few years, PMI VectorLink Project has created several active dashboards for countries. There's IRS campaign dashboards and entomological dashboards. The IRS dashboards are shared immediately with the Ministries of Health and National Malaria Control Programs, so they can see in real time the progress of IRS campaigns. The entomological monitoring dashboards have been developed in the last year, are in use right now, and are being rolled out to Ministries of Health this year. Before I dive into some examples of how these data are used for decision making, I wanted to just give a brief overview of what entomological data is and how it links to vector control decisions, because that's what we've been talking about this whole presentation. So our entomology teams, they have an essential question that they want to answer. What is the type of mosquito that is responsible for transmitting malaria? So they do monthly collections and do a lot of identification and pull together a lot of resources and data to put together a profile for the vector species within a certain area, and can highlight or identify the primary vector within that pool of mosquitoes. This provides insight into the behavior and the abundance of certain species within an area and time that can then help make decisions on what type of vector control interventions should be done in that area. Another bucket of entomological work is monitoring the insecticide efficacy and the impact on the vector control itself. So there's insecticide resistance monitoring that if there is any indication that a mosquito is resistant to a certain type of insecticide, entomologists can inform decision makers to rotate insecticide, for example, or switch insecticide for future interventions. There's also work that's being done to monitor the long-lasting effect of insecticides in vector control measures. And then ultimately, as for example, with the IRS programs within VectorLink Collect, we collect data on the people that are reached and the different populations that are protected for vector control interventions. And this can be done with the ITN campaign module with WHO as well. Now you all are entomologists in training. All right. So now I'm going to dive into an example for a dashboard that we use with the Madagascar team. On the left here is a pie chart that shows the diversity of species that are collected within a full year in the country of Madagascar under the PMI VectorLink Project. You can easily see here that the primary vector species is Anopheles gambiae. And that is depicted in green in the subsequent figures. So here in the next figure, we can see over the calendar months the abundance of Anopheles gambiae with inside people's homes, so the average number of mosquitoes inside a home, and we can see that it increases from September until March. So this can give an indication of when an IRS campaign should occur. And then we can even, based on what Lucia was describing, how there are individuals that track mosquito bites every hour. That is their job. So here we can drill down and see on an hourly basis when the mosquito, specifically Anopheles gambiae, when they are most active throughout the day. So here we can tell that they are most active during night. So this can be an indication that perhaps bed nets are a good intervention as they protect people at night. And then one last example here of we can track based from an IRS campaign that occurred in November. We can track the mortality of mosquitoes over time from when the campaign occurred. So we can see here that from November to February, 100% of the mosquitoes died when exposed to the insecticide. And for this area, the insecticide Actelic was used. And then over here on the right, we can see that for that same area, 100% of the mosquitoes are still susceptible to that type of insecticide. So the entomologists are monitoring the insecticide resistance on the right, and then are able to use that insecticide here in the IRS campaign on the left and monitor how long it lasts to make sure that it lasts for the season where the mosquito is most prevalent and active. So these are some of the examples that we have used within DHIS2 to simplify some of the entomological results that then someone like me, who is not an entomologist, can make some inferences and make some decisions into what vector control interventions might be most worth the resources for that country.
So I hope you have learned the importance of entomological data with Marianne. Very important to decide on what interventions to apply to control malaria. And very sad that it has been underutilized for so many years, that there were not good data collection systems, that it has been collected through Excel files, paper sheets all the time, and that there hasn't been a proper way to analyze this data and use it for improving malaria control. So we are very happy that when we started talking to each other, we identified a lot of synergies to be able to improve the situation, to be able to improve the collection of entomological data and the use of it for malaria control programs. So I just wanted to highlight or recap some of the synergies that we are exploiting now. So on one side, VectorLink, who had gained a lot of experience by collecting entomology and vector control data in countries, was very kind to provide to WHO some of the metadata they had been developing and testing quite extensively in the countries. And this is IRS data and a metadata package to track this mosquito behavior that Marianne was talking about on biting times during the night and things like that. And on the other side, WHO had started developing a laboratory module, which is the mosquito tracker, and a couple of tools to bring in historical data, to bring in data from labs that are analyzing mosquito samples. And we're also able to provide this to VectorLink so that they can use it in their data collection processes. So that has been some of the mutual benefits that we have achieved through the collaboration. And we are currently working on the interoperability side of things that we mentioned before, which is making our DHIS2 instance able to share data, both at global level and in countries. And we face some challenges, unfortunately. Next slide. So the experience hasn't been as smooth, as beautiful as it sounds in this presentation. We definitely had differences in priorities. There was a lot of differences in our metadata, in the scope of our activities. So for example, WHO was prioritizing developing modules for monitoring malaria vectors, but we are also expanding them for other vectors because we are supporting integrated vector control, integrated vector management. So we are expanding and making these modules a bit bigger, while VectorLink is focusing on malaria entomology and vector control. And VectorLink was collecting a lot of more information because they go much deeper into entomology and vector control questions than many of the programs in countries do. And from the WHO side, we wanted to provide to the programs simple data collection forms to collect the key essential indicators that they could use for decision making. So we've done a little bit of, we are still in the process of doing a little bit of alignment to just synchronize some of our data elements, some of our indicators, but not all of them between instances. So future challenges continue to be alignment of this metadata that existed before we started to work together. So there are big differences there because entomology data is not easy. It's not easy to collect. It's not easy to analyze. And so each of us found different solutions for collecting some of these types of data that we are still trying to align. But this is going well. I think it's going to be finished probably by the end of the year. We are very positive that we will be soon sending data or seeing data fly between instances quite easily. So I think this is it. There is one more slide, which is more a call for action. So there is, so we need to continue improving the collection of entomology and vector control data in countries. This is the beginning of the process. VectorLink has done a lot of work on standardizing the collection of this data in countries, in the 18 countries or 17 countries where they are working to collect entomology and vector control data. And they will be able, through this collaboration, to leave this data in the DHIS2 instances of the Ministries of Health, which is a great legacy for the project and increases the sustainability of it as well. But we need more partners to do the same thing. We know there is more people out there collecting entomology and vector control data. We know there is agencies trying to help countries to collect this data. So we are calling all of you to come on board and help to strengthen the collection of this data in countries, talk to us and collaborate so that we can do this all together. This is my last message. And I just want to go quickly to the pool to see what you have answered. Let me see the results. Okay, so you've gotten it right that the mosquito is the most dangerous animal in the world. So last year, 2019, actually, 400,000 people died of malaria only, and mosquitoes transmit other diseases. So imagine how many people die because of this one little animal. I see that many of you haven't heard of somebody's job being collecting mosquitoes one by one, but some of you have done it, which is great. So I see some people have done it themselves. Wow, very impressed. And then I see that many of you are very willing to track mosquitoes through our mosquito tracker. So I see there is interest in the audience. So please reach out to us, and we're very happy to collaborate with all of you to track mosquitoes in the world. So I'll open the floor for questions now. Not sure if there is any on the Q&A. Otherwise, you can probably unmute yourselves and ask the questions.
Thank you, Lucia and Marianne. This has been a really insightful presentation, and I think certainly for many of us, the mosquitoes are the bane of our existence. If anyone else is like me who is allergic to the saliva of mosquitoes, they often hate summertime, which luckily the season is near its end here in Washington, D.C. at least. One of the questions that came in is curious if any surprising decisions have come out of the realization of more data coming in or being more visible to program managers, such as the type of surface or mosquito biting times or degradation of efficacy of insecticides, et cetera. Oh, it looks like we briefly lost Marianne.
Yeah, I was going to say, Maria maybe can answer because they've been working for a longer time with countries and they've been collecting many more data than the data that is coming into, or countries are collecting through the WHO modules, which have been started to be implemented in countries quite recently. So for us, we're still in the starting data collection, training phase in some countries. So probably Marianne has better insights into how programs have reacted to having all of this information in front of us in a quite nicely presented way. But I'm not sure if she's in or not.
Yeah, let me just see. It shows that she's still here. So while we wait for Miriam to be able to join us back and respond, we can move with other questions. And for those of you that are listening in, please feel free to post some more questions in the chat. It looks like Miriam should be joining back. She just left, but she should be back, I think. From my perspective, I think some of the questions that came to my mind are just, you spoke a little bit about the alignment efforts that WHO and VectorLink have had to make in order to create these DHIS2 modules. And so I was curious to know to what extent there was or was not alignment between the DHIS2 modules that you guys are using and those, existing data collection systems within the national malaria control programs at the country level, and whether or not you guys found an implementation that countries weren't collecting these type of data or they were in slightly different formats, and sort of how you guys tackled sort of that challenge.
Quite a big challenge, yes. So what we've been doing is that we develop, from the WHO side, we develop generic packages which are following WHO recommendations for data collection. But then once we started working with the countries on implementing the packages at national level, of course, we realized each country had a slightly different processes. Some of them were collecting additional variables that were not included into the standard packages. So we are now nowadays doing a process of customizing the generic packages for each of the countries to adapt to the existing data collection processes they had in place. So it means the data collection form, but it goes beyond that to the actual process of the people involved into data collection. So it's also, so We also find that when we go to the countries, each country has different partners, and each partner is collecting a subset of the entomology of vector control data that a program should have or wants to have. So bringing everyone on board, trying to align their data collection systems so that whatever is implemented into the National Ministry of Health DHIS2 instance can feed from all of these partners that are collecting data is quite a process. It's feasible, but it takes time of discussing, coordinating with all of the partners. Luckily enough, many of the data collection process or the core of them is pre-standardized. So there is a common set of data elements, common set of indicators that almost everyone is collecting. So the decision lays usually in how many additional things to add on top of the core standard variables or data elements that are usually collected everywhere. So it's a process where we have to bring everyone together. Some partners have showed interest in starting to use DHIS2 themselves because they didn't have other digital data collection systems. And some partners will continue using their digital data collection systems, and we're figuring out with countries how to make the process of sending data from those systems to the Ministry of Health smooth. We still, so it's case by case that we're working on it. In some cases, it's through the bulk load application that we are going to be able to share data. So partners will put it into a template on an Excel file, which will be uploaded into DHIS2 through this application bulk load. And in some other cases, we're exploring proper interoperability between systems. So yeah, quite a lot of work, quite a lot of hours of work that are going into this.
Yeah, and I think following on that, it would be great to kind of hear some of the, you talk a lot about the need for coordination and collaboration, and I can't underestimate, we can't underestimate enough sort of or overestimate enough how much work that actually entails, and sort of the negotiation or agreement and consensus building that needs to come with that. I'm wondering if you can speak to a little bit more around just, recommendations that you have for other organizations and other sort of collaboratives that would like to do this for other health or non-health areas in terms of being able to document and identify what each funder or donor's priorities really are, and sort of come to that consensus to agree on sort of a common data model or sort of architecture and pathway forward when there are so many different opinions, like you mentioned, between the governments themselves, between the donors, and then the implementing partners that are actually being funded by donors who might have their own systems. And just, what suggestions do you guys have for really being able to start that process off smoothly?
So I think one thing that I can say is that for partners or partner institutions and other universities, etc., collaborating with national malaria control programs, being able to show that whatever you do is accessible to the Ministry of Health and can be considered during the development of malaria strategies or malaria program is quite a huge added value to any project. So there's a lot of projects whose result is a scientific article or is findings that end up in a report, but there is no continuity to it. There is no sustainability of that work in a sense. While if all of these projects can feed their findings, can feed their data into Ministries of Health's databases, they're really contributing to strengthening the knowledge base in a country. So I think it's quite a bright objective to present on a proposal, for example, for partners. That could increase the chances of getting a proposal granted to them. So that is one thing. The other thing is, of course, I think we need to do more work on creating a data dictionary, so to say, with common data elements that other partners that are collecting other systems, that are using other systems for data collection, which are not DHIS2, can implement as well. So something that is system agnostic, something that can be implemented in any system. We haven't done that yet, and I think it's something that WHO has to put on the to-do list to try to coordinate developing such a data dictionary.
Great, thank you. hey, everyone else, feel free to ask questions unless you want to keep hearing Lucia and I have a conversation.
I wanted to maybe mention as well on the previous question, because Marianne is not joining, just to say that, so one thing that we do when we implement these packages for countries to collect entomology and vector control data in DHIS2 is that we go to the current visualizations they are using nationally in their global, in their Malaria Programme reviews, in presentations at national level, to try to understand how people understand the information, what kind of visualizations they're used to see, they're expecting to see, and we try to mimic those in the dashboards that we implement in countries. So we come with an example of a dashboard that they could be adopting, and usually it gets modified to incorporate some of the specific graphs that countries are used to see. So this is also how we are trying to increase the use of the DHIS2 by building something that they recognize, that they find familiar, so to say.
You know, Lucia, you've lined up my next question perfectly. I was going to ask about sort of observations that you guys have seen in terms of you know, people's value in data with the ability to collect this granular, very granular data, and sort of not only from the viewpoint of the National Malaria Control Program, but also thinking about the individuals and volunteers that might actually be going out and collecting all the data, and sort of their investment in data and how they've appreciated it, and any observations that you have from that perspective.
Yeah, this is quite of a historical sad story in a sense. So as I was saying before, there is a lot of data that is being collected in countries through projects, through partners, through the Ministry of Health. But because there hasn't been really a way of systematically storing this data in a place, analyzing it systematically, quite often the entomological data hasn't been used. And that has resulted in many of the entomologists not being as important as other public health officers in countries, which is quite sad, because in the case of malaria, if you don't understand the mosquito, you don't understand the disease. Is one crucial component in the cycle of transmission of the disease. So we believe that by making this data they are collecting, by making it more accessible and giving it in an easier way to public health decision makers in ministries of health, the profile of entomologists will raise as well. So they will suddenly be more valuable for informing malaria control decisions at national level. So it's quite sad that entomologists are working a lot. So the mosquitoes, the people collecting the mosquitoes are collecting them at 5 a.m., 4 a.m., throughout the night, 6 a.m., not sleeping. And all of that work sometimes just goes lost in a sense, because it doesn't result in a proper decision or informing a decision. So we really hope that this system is going to solve or contribute towards solving that issue and empowering entomologists to talk about what they know. They know a lot, and they should communicate what they know.
And have you guys been able to, through the project, been able to sort of triangulate the entomological data and some of the profiles that you are gathering there, and the data visualizations that you're getting there, together with service delivery data, to show that, you know, if in areas where you have spraying and you're actually being effective at killing mosquitoes, you're getting them at the right time, you're using the right kind of insecticide, that transmission rates actually start to decrease in those areas that have had successful implementation of entomological sort of reduction strategies.
Yeah, so I see Marianne is here, so maybe she can talk more about it, because as I said, so we are at the earliest stage of working with the countries to implement the WHO packages, so there is not a lot of data in them to get to the point where we can nicely compare all of the trends, epidemiological trends, with the implementation of the vector control interventions. But Marianne probably can say more, because they've been collecting data for quite some time now, at least on IRS.
No, Marianne, it looks like you're still on mute.
Well, okay, that's fine. So I'll talk a little bit about our plans while she finds a way to speak. So from our end, we are working on that on the dashboards. So we are trying to make dashboards that are combining, at the moment, combining the surveillance of adult mosquitoes, so fluctuations on the densities of the mosquitoes, with the implementation and efficacy of the interventions, to try to give a sense of the impact, entomological impact of the interventions, But once these modules are incorporated into the national system, we will be able to work as well on bringing in the deaths and cases, the epidemiological part of things, to really see that correlation on a dashboard. So that's our hope, that's our plan, but we are not yet there.
No, I mean, I think that that's just the idea of being able to have those data available and overlay them is so exciting, and hopefully will be a huge game changer, I think, in malaria prevention strategies. We can, I would certainly love to implement that around my house. Maybe I'll have to submit some data and collect. I can definitely, I was looking at the data, the dashboards that you guys had, and showed 1.5 bites per day, and just thinking, oh, I go outside for like 5 minutes and get bit about 5 times. Yeah. Probably the same mosquito, but I will literally come back with about 5 different welts in my body. So I'm definitely a good entomology specimen and tester.
Just to say one last comment is also that any experiences that we gain through this process of helping malaria programs can be more or less replicated to dengue control programs, Zika, chikungunya control programs, any other vector-borne diseases. So now we are talking about malaria mainly, but it's like opening the door for other diseases to benefit from all of this work as well in the future.
Yeah, I think that's fantastic. Marianne, it looks like you're back. And
am I back?
You're back.
I've gone on a journey. I've gone on a journey around the globe and back. I have been listening. And I will say, in response to the question directed at me, that because we have historical data detailed going back to 2018, for example, in VectorLink Collect, and then even before that in a more aggregated way, we have been able to share that data with countries to do more evaluations that integrate into epidemiological data as well, to be able to show a true impact of vector control decision making. We haven't been able to do exactly like integrate them yet. That's the goal of working with the ministries of health moving forward, but we have been able to work with like specific projects that look at that question.
Great. And then I think going back to the first question, I know that we have about 1 minute left in the session. There was a question around whether or not you guys observed any surprising, if you found any interesting data points in terms of the type of surface or mosquito biting times or degradation of efficacy of insecticides, and whether or not there were any new information that was coming out that was unexpected.
Oh, epidemiologically speaking, there has been some new species that are identified in more prevalence that have been looked at to transmit malaria that wasn't previously noticed or that wasn't previously monitored before. So that's been an exciting turn of events, and we're able to adapt our systems to monitor, like I was showing before with them. So we're excited to be able to adapt as the field of entomology grows as well.
Great. Well, thank you guys both. This has been a fascinating presentation and session, and I think it's great, and certainly looking forward in terms of the stuff that you guys have within your own roadmap, and also the scalability of what you guys are building to expand to other disease areas. We see it, like you mentioned, around dengue and Zika and other malaria-borne diseases, I think can certainly have a huge impact globally, which I think is great.